Good morning, and let me say something that might actually shock you. Everything you think you know about aging gracefully, a good portion of it is wrong. Not slightly off, completely dangerously wrong. And today, I'm going to expose 12 things that seniors do as they age that nobody, not your family doctor, not your well-meaning children, and certainly not the billion-dollar pharmaceutical industry, ever sits you down and honestly tells you about. Some of these things are embarrassing, some are alarming, and at least one of them, the one I'll reveal at number 1, is something that nearly every person over the age of 70 is doing right now without even realizing it's silently stealing years from their life. I'm Dr. Daniel Hayes, and before I spent the last 2 decades working in geriatric medicine and surgical care, I thought I understood aging. Then I sat with thousands of patients between the ages of 60 and 92, and I learned the truth. The messy, uncomfortable, no one talks about it truth. A landmark study published by the National Institute on Aging tracked over 14,000 adults over the age of 65 for a period of 12 years. What they found was staggering. 91% of participants were engaging in at least 4 behaviors that were directly accelerating their physical and cognitive decline. And not a single one of them knew it. 4 behaviors quietly working against them every single day. That's what we're unpacking today. And before we dive in, I want to ask you something personal. Drop your age in the comments below and tell me what is the one thing about getting older that nobody warned you about. I read every single comment on this channel, and your answer today might just inspire a future video that helps someone else. Now, let's count down from 12 to 1. And number 1 will genuinely change the way you think about your body, starting at number 12. Number 12 is something I see constantly in my practice, and it breaks my heart every time. It is the slow, gradual retreat from social connection. And seniors do it so quietly that nobody notices until the damage is already done. It starts innocently enough. You skip one dinner. You let a phone call go to voicemail. You tell yourself you're just tired, just introverted, just not in the mood. But here is what the science shows, and it is sobering. Researchers at Brigham Young University analyzed data from over 3 million people and concluded that social isolation carries a mortality risk equivalent to smoking 15 cigarettes a day. 15 cigarettes every single day of loneliness. After the age of 65, the brain begins reducing its production of oxytocin and serotonin, the bonding and happiness chemicals, more rapidly than at any prior decade of life. Think of social interaction like oil for an engine. Without it, the parts don't just slow down, they start grinding against each other. Inflammation rises. Cortisol, that's your primary stress hormone, spikes chronically. And chronic cortisol elevation, as shown in research from University College London, shrinks the hippocampus, the memory center of your brain, at nearly twice the normal rate. I had a patient, Margaret, 78 years old, from Boise, Idaho. After her husband passed, she spent 14 months barely leaving her home. When she came to see me, her cognitive scores had dropped significantly. Her blood pressure was dangerously high, and she told me she felt like she was disappearing. We built a simple social prescription: 2 community events per week, 1 phone call per day to a friend or family member. 8 months later, her inflammation markers had dropped, her blood pressure normalized, and she said, and I'll never forget this, she said, I feel like I came back to life. Connection is medicine. Never let anyone tell you otherwise. Number 11 is one that makes my patients laugh nervously because they know they're guilty. It is the habit of eating the same thing every single day, believing that routine equals health. I understand the appeal: simplicity, comfort, familiarity. But nutritional monotony in seniors is a silent catastrophe. After the age of 70, your body's ability to extract micronutrients from food decreases by up to 40% due to reduced stomach acid production, a condition called hypochloria. So, if you're eating the same narrow rotation of foods, you're not just missing variety, you're creating genuine nutritional gaps in an already compromised absorption system. Research from Tufts University's Human Nutrition Research Center on Aging found that seniors with low dietary diversity were 62% more likely to experience significant muscle loss, cognitive decline, and immune dysfunction than those who rotated a wider variety of whole foods. The mitochondria, think of those as the tiny power plants inside every single one of your cells, require a rotating cast of vitamins, minerals, and phytonutrients to keep functioning. Feed them the same fuel every day, and they start to sputter. The practical fix is genuinely simple. Each week, introduce one food you haven't eaten in the past 2 weeks. Rotate your proteins between fish, legumes, eggs, and lean poultry. Vary your vegetables by color: orange, dark green, red, purple, because different pigments represent different protective compounds. Pair your meals with a small amount of healthy fat like olive oil or avocado to enhance absorption of fats, soluble vitamins A, D, E, and K. Variety isn't just the spice of life after 65. It's the foundation of it. Number 10. And this one surprises almost everyone who hears it for the first time. Seniors chronically overrest after physical exertion, and it is quietly destroying their muscle tissue. Now, I'm not saying rest is bad. Rest is essential, but there's a phenomenon called anabolic resistance that accelerates dramatically after the age of 60. Anabolic resistance simply means your muscles have become stubborn. They don't respond to normal recovery signals, the way a younger body does. A 30-year-old can take 2 full days off after exercise and come back stronger. A 70-year-old who takes 2 full days off may actually lose ground during that window. Studies from McMaster University in Ontario showed that older adults require more frequent but lower intensity movement between rest days to maintain muscle protein synthesis, the process by which your body actually builds and repairs muscle fibers. Think of it like a campfire. A young person can let the fire die down for 2 days and rekindle it easily. A senior needs to keep adding small pieces of wood consistently to prevent the fire from going out entirely. The practical guidance here is to incorporate what researchers call active recovery. 15 to 20 minutes of gentle walking, light stretching, or resistance band movements on your off days. Do not go from intense exercise to complete stillness. Keep the fire burning. Your muscles, your metabolism, and your bone density will all thank you for it. Number 9 is deeply personal and rarely discussed openly in any doctor's office, which is exactly why I feel compelled to bring it up here. It is the widespread habit among seniors of drastically reducing water intake, often unconsciously, because the sensation of thirst diminishes significantly with age. Here is what is alarming about that. Research published in the Journal of Gerontology found that by the age of 75, the thirst mechanism in the human brain can be up to 40% less sensitive than it was at 40. So, your body is becoming dehydrated, and your brain simply isn't sending the warning signal clearly anymore. Chronic mild dehydration in seniors accelerates joint deterioration, reduces kidney filtration efficiency, thickens the blood, increasing stroke risk, and this is the one that truly disturbs me. It mimics and worsens the symptoms of dementia. I have seen patients referred to me with suspected cognitive decline who were, in plain terms, simply not drinking enough water. Proper hydration restored meaningful clarity within weeks. The target for most seniors is 6 to 8 glasses of water per day, but timing matters enormously. Drink a full glass upon waking, before coffee, before anything else, because overnight your body loses significant fluid. Pair hydration with electrolytes, particularly potassium and magnesium, which decline with age and help your cells actually absorb and retain water rather than simply passing it through. Herbal teas and water, rich fruits like watermelon and cucumber count toward your daily total. Set a phone alarm if you need to. Drink before you're thirsty, because by the time you feel thirsty, you're already behind. Number 8. And this one is something I've raised in conference rooms with other physicians and watched people get genuinely uncomfortable. Seniors massively under-advocate for themselves in medical settings. They accept diagnosis without asking questions. They fill prescriptions without asking about alternatives. They leave appointments confused and never call back to get clarity. And the consequences are severe. A study from the Journal of Patient Experience found that seniors who actively participated in their own medical decision-making had 34% better health outcomes over a 5-year period than those who passively deferred to their providers. Your body is not the same body it was at 45. Medications that were appropriate then may be inappropriate now. Dosages change. Interactions between multiple drugs, a condition called polypharm pharmacy, which simply means taking many medications simultaneously, create compounding problems that not every physician has the time or bandwidth to monitor carefully. After the age of 70, the liver and kidneys process medications more slowly, meaning drugs stay in your system longer and at higher concentrations than the label was designed for. Write down your questions before every appointment. Bring a trusted person with you when possible. Ask specifically, Is there any medication I'm currently taking that could be deprioritized or replaced with a lifestyle intervention? You are not being difficult. You are being your own best advocate, and that habit alone can add quality years to your life. Number 7, and we're getting into the territory that surprises people most, is the quiet epidemic of seniors sleeping too much. Now, I know you've heard the opposite warning your entire life. Get more sleep. Rest is healing. And that remains true to a point. But research from the American Academy of Sleep Medicine has found that adults over 65 who regularly sleep more than 9 hours per night show a 37% higher risk of cognitive decline and a significantly elevated risk of cardiovascular events. More is not always more. Here's the physiological reason. After 70, the sleep architecture, meaning the stages and cycles your brain moves through during sleep, changes fundamentally. Deep sleep, the most restorative phase, decreases. The body compensates by spending more total time in bed, but that extra time is largely spent in lighter, less regenerative sleep stages. The mitochondria in your brain cells are particularly dependent on efficient deep sleep for cellular cleanup, a process called autophagy, which is essentially your brain taking out its own trash overnight. The optimal window for most seniors is 7 to 8 hours, not 9 or 10. If you find yourself unable to stay awake in the evening and sleeping well past 8 hours, that may signal a vitamin D deficiency, thyroid dysfunction, or anemia, all of which are extremely common and extremely treatable in older adults. Bring this up with your doctor. Excessive sleep is not lazy. It is often a symptom, and symptoms deserve investigation. Now, before we get to our top 6, I want to pause and say, if this information is opening your eyes, please hit the like button right now and subscribe to this channel if you haven't already. We put out medically grounded, senior-focused content every week, and your support makes it possible to keep this information free and accessible to everyone who needs it. Now, let's continue. Number 6 is one that I see most commonly in my patients over 75, and it stems from the best of intentions. It is the abandonment of strength training because it feels dangerous, inappropriate, or too intense for my age. And I want to say this as directly and as kindly as I can. That belief is one of the most physically costly misconceptions in senior health. After the age of 65, the human body loses between 1 and 3% of muscle mass per year in a process called sarcopenia. After 75, that rate can accelerate to 5% per year without resistance training. Muscle is not vanity. Muscle is your metabolic engine, your fall protection system, your insulin regulator, and your independence. Research from the University of New Mexico showed that seniors who engaged in twice-weekly resistance training maintained bone density, preserved balance, and reduced their risk of life-threatening falls by up to 40% compared to those who only performed aerobic activity. I had a patient, Harold, 81 years old, from Tucson, Arizona. He came to me after his second fall in 18 months using a cane, convinced his body was simply done. We started him on a gentle twice-weekly resistance band program. 18 months later, Harold had discarded the cane, gained 9 pounds of muscle, and told me he felt stronger at 81 than he had at 75. The body responds to demand at any age. You simply have to make the demand. Number 5 is something that the wellness industry profits enormously from keeping you confused about, and it concerns vitamin D and its relationship to what researchers now call the master hormone of aging. After the age of 60, the skin's ability to synthesize vitamin D from sunlight drops by approximately 50%. Simultaneously, the kidneys, which convert vitamin D into its active, usable form, become significantly less efficient. The result is that an overwhelming majority of seniors are walking around in a state of chronic vitamin D deficiency, even if they're spending time outdoors regularly. Vitamin D deficiency in seniors has been linked in studies from Harvard Medical School to increased rates of depression, accelerated bone loss, impaired immune function, and alarmingly a 40% higher risk of dementia. And here is the connection to what researchers call the master hormone of aging. Vitamin D directly regulates testosterone and estrogen production in older adults, both of which decline dramatically with age, and both of which are essential for muscle maintenance, mood stability, cognitive sharpness, and cardiovascular health. The practical guidance is to ask your doctor for a 25-hydroxy-vitamin D blood test. Most seniors need between 2,000 and 4,000 international units of vitamin D3 daily, but critically always pair it with vitamin K2 because K2 directs calcium to your bones rather than your arteries. And take it with your largest meal of the day, since vitamin D is fat-soluble and absorbs dramatically better alongside dietary fat. This single correction properly implemented can produce changes you will feel within 8 to 12 weeks. Number 4, and we are getting close to the top now, is a habit so universal among seniors that it almost functions as a cultural expectation, and that is dramatically reducing protein intake as appetite naturally decreases with age. Seniors eat less, and when they eat less, protein is almost always what gets cut. And the biological consequence of that decision is catastrophic for the aging body. Due to the anabolic resistance I mentioned earlier, older adults actually require more dietary protein per pound of body weight than younger adults, not less, to maintain the same rate of muscle protein synthesis. Research from the University of Arkansas for Medical Sciences recommends that adults over 65 consume between 1.2 and 1.6 g of protein per kilogram of body weight daily, significantly higher than the general adult recommendation. When seniors fall into protein deficiency, the body initiates a process called catabolism. It begins breaking down existing muscle tissue to harvest the amino acids it needs for basic survival functions. Think of it like a building owner stripping copper wiring from the walls to sell for cash. You're cannibalizing your own structure. This leads to accelerated weakness, immune suppression, slower wound healing, and the kind of fragility that makes a simple fall a life-altering event. Spread your protein across every meal rather than concentrating it at dinner, because the aging gut can absorb and utilize roughly 25 to 40 g of protein at a single sitting. Prioritize leucine-rich proteins, eggs, fish, dairy, and legumes, because leucine is the specific amino acid that most powerfully triggers muscle protein synthesis in older adults. Pair your protein meals with a short 10-minute walk afterward to enhance nutrient uptake and insulin sensitivity. This is not optional supplementation. This is structural maintenance for your body. Number 3, and I want you to really sit with this one because it touches on something deeply psychological that goes far beyond nutrition or exercise. It is the quiet, pervasive habit of seniors surrendering their sense of purpose, retiring from not just work, but from meaning. Research from the Rush Alzheimer's Disease Center in Chicago followed over 1,500 seniors over 7 years and found that those with a strong sense of purpose were 2.5 times less likely to develop Alzheimer's disease and lived an average of 7 years longer than those who reported feeling purposeless. 7 years from something as invisible and as profound as meaning. When purpose disappears, the prefrontal cortex, the brain's command center for decision-making and personality, begins to lose stimulation and literally shrinks in volume. Simultaneously, inflammation throughout the body increases because the immune system loses the regulatory influence of the brain's positive engagement circuits. I had a patient, Eleanor, 72 years old, from Portland, Oregon, who retired and within 18 months had developed significant depression, early memory lapses, and chronic joint pain that defied medical explanation. We worked together to help her identify a new purpose. She began mentoring young women in her former profession 2 mornings per week and started a small container garden. Within a year, her inflammation markers normalized, her memory scores improved, and her pain had reduced by over 60%. Eleanor told me, "I didn't realize I had retired from myself." Find your reason to get up in the morning. Protect it fiercely. It is among the most powerful medicines known to science. Number 2, and I promised you early that this one would be shocking. So brace yourself. It is the near universal habit of seniors breathing incorrectly. And I mean that in a specific physiological, measurable way. Chronic shallow chest breathing, which nearly all adults default to by their 60s, reduces oxygen delivery to the brain and tissues by up to 20% compared to proper diaphragmatic breathing. Research from the Cleveland Clinic has shown that shallow breathing chronically elevates cortisol, increases systemic inflammation, raises blood pressure, and reduces heart rate variability, which is a key marker of cardiovascular resilience. After the age of 65, the respiratory muscles weaken. The lung tissue loses elasticity, and the diaphragm, the primary breathing muscle that sits beneath your lungs like a dome, becomes underused and weakened. The result is that most seniors are running on reduced oxygen every hour of every day without realizing it. And the brain, which consumes 20% of your body's oxygen supply, despite being only 2% of your body weight, suffers first and most. Cognitive fog, fatigue, anxiety, and poor sleep are all amplified by this silent oxygen deficit. The intervention is simple and requires no equipment and no prescription. Diaphragmatic breathing practice. Inhaling slowly for 4 counts, allowing the belly to expand rather than the chest. Holding briefly and exhaling for 6 to 8 counts, practiced for just 10 minutes daily, has been shown in trials at Massachusetts General Hospital to measurably reduce blood pressure, lower cortisol, improve sleep quality, and enhance oxygen saturation in older adults. Do it upon waking. Do it before meals. Do it whenever you feel anxious or fatigued. The air you're already breathing can heal you more effectively if you learn to breathe it correctly. And now we arrive at number 1. The single most damaging thing that seniors do as they age. The one that the medical system rarely confronts. The one that quietly undermines every other healthy habit you have, is the habit of accepting pain as inevitable and stopping movement because of it. I don't mean catastrophic pain that requires medical evaluation. I mean the chronic aches, the stiffness, the morning joint discomfort that seniors universally interpret as a sign to slow down and be still. And that interpretation, I need you to hear this clearly, is physiologically backwards. Synovial fluid, the lubricating substance inside your joints, is not passively maintained. It is actively produced and circulated through movement. When you stop moving because of joint pain, you are starving the joint of the very fluid that reduces that pain. Think of it like a squeaky hinge. Most people stop opening the door because it squeaks. But the answer is oil, and movement is the oil. Research from Johns Hopkins Arthritis Center found that gentle, consistent movement reduces joint pain in seniors by up to 47% over 12 weeks more effectively than anti-inflammatory medications in many cases, and without the gastrointestinal and cardiovascular side effects those medications carry. Beyond the joints, chronic inactivity born of pain avoidance triggers what researchers at Stanford University have called an accelerated aging cascade. Within 72 hours of reduced movement, muscle protein synthesis slows, insulin sensitivity drops, cardiovascular efficiency decreases, and inflammatory cytokines, the chemical messengers of inflammation, begin accumulating in tissue. 1 week of significant inactivity in a senior can take 3 to 4 weeks of consistent movement to reverse. And the longer the pattern continues, the harder the reversal becomes. I had a patient, George, 74 years old, from Nashville, Tennessee. Knee pain had led him to stop his morning walks 18 months before he came to see me. In those 18 months, he had gained 22 pounds, developed prediabetes, lost significant muscle mass, and his knee pain had paradoxically worsened despite the rest. We started with water walking, gentle movement in a pool that reduced joint load by up to 80%, and progressed over 4 months to dryland walking, then light resistance training. George lost the weight, reversed his prediabetes, and his knee pain is now a 3 out of 10 compared to the 8 out of 10 that had stopped him from living. Movement was the medicine, not rest. Movement. Here's what I want you to take from today. Aging is not a passive experience that happens to you. It is an active process that you participate in for better or for worse with every choice you make each day. The 12 things we discussed today are not character flaws. They are understandable, deeply human responses to a body and a world that are changing around you. But understanding them, naming them, and choosing differently is absolutely within your power, regardless of your age or your current condition. I have seen transformation in patients in their 80s. I have watched people reclaim independence, vitality, joy, and purpose at ages when the world had quietly written them off. It is never too late. Not at 70, not at 80, not at 92. The body is remarkably forgiving when you give it what it actually needs. Your quality of life is not a fixed destination. It is a direction, and you can change direction today. If this video gave you something valuable, please subscribe to this channel right now and hit that notification bell so you never miss what we publish each week. Leave me a comment below telling me which of these 12 surprised you the most and share your age. I genuinely read everything you write, and your stories matter deeply to me. All scientific references for everything discussed today are linked in the description below. Share this video with someone over 60 who needs to hear it, and I'll see you in the next one. Take care of yourself because you are absolutely worth it.